Hi everyone, this is a video about CD57 cells. Just before getting into the video, if you don't mind taking a quick second to either like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So someone recently sent me a question asking, do I think that tracking a CD57 count is important? So it's a great question. CD57 counts are things that I don't really hear them talked about that often these days. I feel like several years ago, maybe 10-ish years ago, actually, now that I think about it, they were more commonly discussed, brought up at conferences and things like that. I feel like there's not a lot of discussion around them nowadays, but a CD57 count is basically measuring the number of white blood cells that have this CD57 antigen expressed on them, and these CD57 expressing cells are generally natural killer cells or potentially T lymphocyte cells that are particularly cytotoxic. They're quite good at killing off abnormal cells like cancer cells or precancerous cells, and they're also good at killing off microorganisms as well. And so the interest around CD57, to my understanding, stemmed from the fact that some clinicians were finding that if they'd measure the amount of CD57 cells, if they were at a high level, it seemed to be associated with better outcomes and kind of a better clinical status for folks who are dealing with chronic infections, particularly persistent borreliosis, also known as chronic Lyme disease. And if a person had low CD57 counts, like, oh, they're probably not doing as well. They're not, their immune system's not as able to fight off the infection along with the herbs and antibiotics and whatever it is the person's working with. So the general gist of it was low CD57 is bad, high CD57 is good, and that's something that was that can be tested by various labs. I think maybe one of the reasons why the CD57 count isn't really talked about as much anymore is because there have been some studies looking at the kind of usefulness and reliability of CD57 counts. One of the things that I heard about prior to learning about these studies or before these studies were conducted is that clinicians would say, yeah, I run CD57 counts, but if I run them, quite regularly on patients, say we're doing blood work for some reason every, 1 to 3 weeks or something like that for some reason, say a patient's, on heavy dose antibiotics, and so they're checking liver enzymes regularly, or they're tracking, the progression of their anemia or something. Oh, let's just throw in a CD57 for good measure. Then the clinicians, I've had heard some clinicians report that they were just seeing the CD57 numbers being all over the place. A patient could be feeling just about the same clinically over the span of a month, and their CD57 might look fantastic one day and terrible the next day, or the first test and terrible the next test, and it just didn't really seem to clinically correlated. It seemed kind of haphazard. And so, to my understanding, there have been a few studies that have been done looking at CD57 counts and kind of their kind of clinical reliability. And if memory serves, I believe that one of those studies indicated or suggested, like, yes, this is useful, and then the other study suggested that it really wasn't all that useful at all. So kind of armed with that information over the course of time, I really haven't recommended that my patients get their CD57 levels tested. I've maybe recommended it once or twice. I've certainly seen a number of patients come in with their CD57 counts, but again, I just don't really know what to make of the results. I know what their relevance is of a CD57 expressing cell, but I don't know how clinically relevant those results are given what I've heard from colleagues, what it says in the the mixed reviews in the scientific literature. And so I personally don't recommend that my patients get CD57 counts. If they want to get them done, fine, we'll do them. But I don't believe that there's a robust amount of clinical utility. So I think financial resources or whatnot could be spent better elsewhere. So I hope that answered the question. If anybody listening has had experience with having your own CD57 counts done, and you feel free or feel open to. If you feel comfortable, that's the word I'm looking for. Feel comfortable sharing that information in the comment section. Love to hear about it. Were CD57 counts helpful with the management of your case? Unhelpful? Any thoughts, or if anybody's listening thinking like, there's a study that just came out, within the last couple of years, and it completely flies in the face of everything you just said. I'd love to hear any feedback about CD57 cells if you have any to share. And if there's any questions about this topic or any other topics, just post in the comment section below, and I'll do my best to answer as soon as I can.